Hello, my name's Nick Grasby. I'm 61 years old. I was diagnosed with prostate cancer in 2007, November 2007. I had no idea that I had prostate cancer. It was just I went to my GP, and because at that time I'd just turned 60, she decided to give me a few blood tests just to see if everything was in working order. And I thought that was fine. And one of these blood tests was a PSA test, which frankly I knew nothing about. I had my blood tests and thought nothing else about it. And all my other blood tests came back fine, except the PSA. And my PSA reading was a little bit high. And this didn't mean anything to me at all. So I was given another PSA test a little while after, and that was higher still. So I was sent down to the Leicester General Hospital for a biopsy. Now the biopsy consists of a rectal scanner being inserted into your backside and a long needle being put inside your bum and samples taken of your prostate gland. Because while the PSA test is good, it's not the definitive answer to prostate cancer. Your PSA can be high for a number of reasons. However, when the results of my biopsies to the prostate came, it showed that I did have prostate cancer. And this was quite a shock at the time, and I was sat there with my wife when I was told. And it was like it was weird. I thought, oh no, I've not got cancer. But anyway, the results were there and I had. And I was offered 4 treatments. One was just watch and wait. The second one was brachytherapy. The third one was external beam radiation. And the fourth one was a radical prostatectomy. All of which meant absolutely nothing to me at all, other than the watch and wait. I was then passed over to my cancer nurse, and she explained things in a little bit more depth. Bearing in mind I've only been diagnosed with cancer about half an hour prior to this. So I told them at the time that I wanted to go home and think about this. So what I would do is I would take the watch and the wait option. So then I could see if I could learn anything about what was going on, because I didn't know. So I went on the web, and you can speak to your cancer nurse and this, that and the other. And it was over the Christmas period that I started to, it played on my mind, the fact that I've been diagnosed with cancer, bearing in mind that my father and my brother before me had both died of cancer, albeit not prostate cancer, but it was cancer nevertheless. And I thought, well, it's me next. So, and I thought, and I'm not having any treatment, and that played on my mind. And so I'd looked up various treatments, and I decided that if I ticked all the boxes, I would have liked brachytherapy. So in the February of 2008, I phoned my cancer nurse up and explained that I think it's time I was doing something about this prostate cancer. So she arranged for me to see the brachytherapy consultant, Mr. Khan, and basically we took it from there. But what happened was I had an enlarged prostate. And when they do the brachytherapy operation, which I will come to in a moment, but your prostate has to be a certain size, right? And mine was 77 centilitres, and that is too big. They can't get the needle into your prostate to put the seeds in properly. So I had to go on a drug called Zoladex, which shrinks your prostate. It stops you producing testosterone. And that's what the cancer feeds on. It feeds on that in your prostate. And the drug did the trick. I'm still on Zoladex at the moment. And it did the trick for me. It did shrink my prostate. And on October the 16th of this year, I went into Northampton General Hospital, where I had the brachytherapy operation. You don't know anything about it, you're put to sleep, but what they've got is a rectal scanner with a plate. If you can imagine, you're laid on your back with your legs in the air, and you've got stirrups with your legs in stirrups, legs wide apart, very inelegant. But this rectal scanner goes inside your bum and it gives them a colour picture of your prostate and your bladder. And they also insert a catheter, basically so they can see where your urethra is, because they don't want to inject the seeds into that. And I had the procedure done. And the way they inject the seeds in, it's a hollow needle, and they inject these iodine radioactive seeds inside your prostate. And from there, these iodine seeds they're roughly active for about 12 months or so. And hopefully they kill the cancer off. But it isn't a comfortable procedure. It can have its side effects. You have a sore bum, it can hurt you when you urinate. But mine is about a month on now, and my side effects are gradually fading away. And although I do still sometimes have a problem urinating, but everything else seems to be working okay. I'm going back to see my oncologist in about a week's time, so I shall know more then. But at the minute, everything is progressing very nicely.
My treatment was much quicker. I went in to see the doctor and said that I would get up in the night to wee, but it didn't seem to be coming very much, and it was very slow. And she said, well, I'll add a PSA test into your review for your hypertension. And sure enough, this PSA came back and it was 5. And she says, I think you ought to go and see a consultant. So I went along to see the consultant, and he said, you need another test. Take a sample of your prostate to see whether you have actually got the cancer or not, because a PSA test is not conclusive. And sure enough, it came back and there was a reading of 7, which is between, well, almost aggressive, they told me. And they gave me the choice of watch and wait, they said, well, have you got any ideas on what you'd like? And I'd read about brachytherapy, and I thought that sounds good, less interference with your body than surgery. So I chose to see a consultant about surgery and brachytherapy. And I saw both the consultants, and I chose to have brachytherapy. So from being told that I'd got cancer in June, by the end of August I was having treatment for it. Before the treatment I saw a consultant and nurse, and she went through an awful lot as well. So you were told pretty well what was going to happen. I would like to say that what happens is a little bit more disturbing to you than they tell you. It's a little bit more traumatic. So I went to Northampton, had the treatment, woke up with an ice pack between my legs, feeling quite sore and very sick. I don't like anaesthetics very much. It doesn't sort of suit me. I've had them before. I was quite sick. And I had a catheter, that is normal. They took the catheter out the next day, but I couldn't pass water, so they wouldn't let me leave. I had to stop in for another night and have the catheter refitted. I got on quite well with the catheter, but it was one that you have a different bag for night time than daytime, and the design of it wasn't particularly brilliant. It came apart in the night, so it wet the bed, which was very disturbing. You don't like that sort of thing. So out came the insulating tape, and I taped it together from then on until I actually got rid of it. Getting rid of the catheter worried me as well. I thought, well, is it going to hurt? What's it going to do? pulling this great big tube out, painless. It just dropped out more or less, so that was okay. While I'd got the catheter, I was passing a little bit of blood, obviously, because it was slightly pink. And I did have a couple of infections, but they soon cleared up. My bottom, well, very, very painful. And the consultant did say later on that I'd got a soggy bottom. It was one of the soggiest he'd seen, which I found quite amusing, but it was very painful. Since then, the side effects have got less and less. About 7 or 8 months, the bottom stinging and stuff had settled down, and I began to pass water with more confidence. It's a bit off-putting when you go to a public convenience and there's people walking, and especially if you're watching a rugby match and you go to the toilet and there's all these big blokes around you, and you feel as if you're quite a big bloke yourself, and you think, God, where's he getting all that from? And you're standing there dribbling more or less. But it's getting a little bit better now anyway, so I'm feeling quite confident. The PSA is down to 0.03, so I'm feeling very happy about the future.